So,
Hey,
Kendra and Chloe show.
what's up?
What's up? Hey, Kendra.
Hey.
Hey. Hey, guys.
Welcome back to my channel. Today I'm here with Chloe, and she is a primary care physician assistant. So I wanted to ask her some questions to see what her day is like, what her life is like, so that you guys can find out about it. So let's get started.
Alrighty. It's not that great. Just kidding. It's pretty great.
All right, so why did you choose primary care?
I love being able to use everything that I learned in school. So literally everything you learn in school, you see in primary care, just about. Every day you see different things and you have to research things all the time to, stay up to date, and you're kind of like a jack of all trades where you know a little bit about everything. But it's difficult when you get difficult cases and, you gotta refer them to a specialist.
Great. All right. So, how long have you been working in primary care?
I've been at my current position for 2.5 years, and I actually didn't think that I would love it as much as I do. I really, really have grown to love primary care. I love creating relationships with people and following their health, and just seeing how when they listen to you, it's incredible because their lives change, and when they're adherent with medications and with their lifestyle changes that we recommend. It's so amazing to see their A1Cs improve, their cholesterol improves, their blood pressure medication goes away. They feel better, they're dating again, they have their life back, they're happier. Or people who are suffering from mental illness, if we put them on medication, and I tell them always to read a few books like The Power of Now and do some meditations and things, and they come back, they feel better, they're working again, and it's amazing.
Love that. So what does a typical day look like for you? Like what time you start, how many people you see, stuff like that?
So when I get into the office, I usually check my schedule, and I have a bunch of medication refills and tasks, patients calling them back, reviewing lab work, reviewing diagnostic imaging, and putting in any referrals that need to be done for further imaging, or calling patients back and letting them know about their results. And then I see typically about 20 patients per day in primary care. My hours are usually 9 to 5. So, you're just running in and out of rooms, and then spending about, 20, 25 minutes with people, which I would love to spend longer, but, it's
not enough time.
Yeah, not enough time. So, but I see anything from annual physicals, STD testing, or people coming in thinking they have an STD, or cough, the flu, screening for cancer, mammograms, colonoscopies, pre-ops for surgery. People come in and say this hurts or that hurts, or this is happening when I go to the bathroom, or I'm not going to the bathroom, or anything is that I'm having pain in my stomach, I broke my toe, and I have this rash. We see everything. So we're kind of like the front lines of healthcare, where people come in and see us first for whatever's going on, and if we can't solve it, then we will refer to a specialist, and they'll get the help that they need. But usually they'll come see us, and then if it's not working out, they'll come see us again, and then we'll decide if we need to refer, do something different.
Okay. So I know your schedule has changed recently. So what was your schedule like before? Has it changed? What does it look like?
So yeah, I was doing a ton of traveling at first, and my position was very unique because it was an outpatient clinic that was open 12 hours in primary care, which is kind of unheard of. Most urgent cares or ERs have that type of shifts. But I was working 3 12-hour shifts at first, which I loved. It was incredible. Because obviously you get off 4 days a week. And then I was changed to 4 10s, and now to 5 8s. So I definitely love the 3 12-hour shifts. Obviously you can understand why, but those days are super long and like a marathon. Like you come home from work and you just want to face plant in your bed and you almost need like a day to recover afterwards, because it's just, you're nonstop for 12 hours. So it definitely has its pros and cons, but and usually primary care is a 9 to 5 type of office situation. But if you can find something that's 4 10s or 3 12s, by all means, that's great.
So I always say so first, it's so annoying. this your first job since you've been out of PA school. So what was your experience first starting out in the job? Were you nervous? Did you feel like you were prepared?
So this is an amazing question. People, people always like PA versus MD. Okay, when you're a doctor and you're done with residency, and so you've gone through medical school, you've gone through residency, you've taken your boards, you've really seen and done it all at that point. I mean, you are like very prepared for the job ahead of you, and people are going to be calling on you like as a last resort. Whereas the PA model is kind of set up where, we see a little bit of everything during PA school. We are not doing residency, and then we are expected to almost perform like an MD when we come out of school, which is kind of like setting us up for failure. So you gotta be, you have to have a conversation with your supervising physician or your employer that, they need to have the proper training in order, because when you come out of PA school, you don't know anything. You really don't know anything. I mean, you can take a test all you want, but real life, seeing stuff and identifying things and doing the proper things, and every person is different, every presentation is different. Patients don't present like a textbook. They present differently than the textbook, and you have to see enough cases to be able to recognize that. So definitely the learning curve is super steep. I know for my first job, I worked in dermatology for 3 months, which was a short-term job, and I was kind of just doing like procedures, and I wasn't really doing a lot of medicine. But then when I went into primary care, I didn't know anything. Like when I say I didn't know anything, like I learned, I knew what the book said, and the learning curve is steep, and it never stops. I'm still learning things every day. 2.5 years at the same job, I'm still learning things, I'm still looking up things, I'm still asking questions. Especially because primary care is so hard to master, since it's such a wide variety of things. And if you do have hospital experience before you go into primary care, I mean, that's just like incredible, which I work with a lot of physicians who had hospital experience. So they are like experts, top of the line primary care physicians. And, I'm trying to think what else. So, you just want to really make sure that you have the support and people who will let you make mistakes, grow, and understand where you are, and not expect you to perform like a physician who's been through residency, because honestly, we haven't.
Yeah. You get to do any procedures in your office?
You have to cut this out.
Under fluoroscopy?
Yeah. So let's just start off with that question again.
Okay. Do you get to do any? Oh.
That's okay. So the procedures that I do most often are lacerations, abscesses, arthrocentesis with fluoroscopy. Did I say trigger point injections? Trigger point injections for sciatica and low back pain. Sometimes I'll do bicipital groove injections if people have shoulder pain, but that's only if they can't see an orthopedic. And I'm trying to think what other procedures I do. In primary care? I think that's it. Pap smears, if that's not really a procedure.
Kind of.
Yeah, pap smears, and which are pelvic exams and rectal exams.
Those are good ones.
If necessary. Those are good ones.
Those are good ones. So, of course, everybody's concerned about their work-life balance, so tell us about yours.
So definitely for the first 2.5 years when I had that schedule, I was living my best life. I mean, I was working, and then I would have my day or two off that I would be able to exercise and meal prep and, do whatever. But honestly, on top of that, my employer has been amazing at letting us, meaning the PAs, share, create our own schedule and switch and swap shifts. So, if I can't come to work, my coworker will cover me, and we kind of like negotiate that amongst ourselves and then submit it. And as long as there's coverage, we can usually take off. This has kind of changed though, and I realize that it's not like this in a lot of other places, because it's obviously difficult to do this though, because in primary care there's continuity of care and patients want to see you. They don't want to see the other PA or the other, even sometimes the other doctor. They want to see you because you know their story. So that becomes difficult. So you do have to like give more ahead of time of taking off work. But these are questions that you always have to ask your employer. Like, who who creates the schedule? Who do you submit your time off to? How long do you need to submit time off ahead of time, before it can be approved? The details of like, can you get coverage? What if you have an emergency sickness? What if you need to call out work? Like, all these questions should be addressed when you're interviewing.
What would be your best advice for somebody who wants to get into primary care? Just apply, you'll get the job.
Exactly. So there's a huge need for primary care, PAs, nurse practitioners, doctors, and I feel like the PA profession was created a lot to extend the primary care physician because there is such a shortage of primary care physicians in America.
For someone first starting out in their primary care job, what would you say that they could do to help prepare themselves to actually start the job?
For a new grad coming in, to prepare yourself, get a good book, a good resource that you can refer to all throughout the day and at night, and you go home and read about it. So whenever you see cases, you just go home and read about the cases, and that's really the best way to learn. And then on the weekends, read more about what you're seeing, and that's really the best way to prepare. I mean, obviously you can. Okay, so I actually do have a good tip. So a good tip to prepare is to ask who you're going to be working with, or just Google what are the most frequently seen pathologies that you're going to be seeing. So you're going to have your bread and butter diseases. You have to be able to make sure that you don't miss things that could really kill somebody. And that's the scariest and most important thing that you need to study up first. So you ask your physician who you work with, what can I not miss? And they'll tell you.
Great question. So that was it. That was the video. Thank you guys so much for watching.
Thanks for
I hope
watching.
you guys learned something from this, and
I love Kendra.
we'll see you next time.
Wait, quick PS. Kendra and I went to middle school together.
We did.
And we reconnected when we both realized that we were PAs. Actually, I think I was in PAs.
We were both in the PA school, and we were both on our psych rotation.
Yes.
That's when I saw you.
Yes.
We had a psych rotation together.
And she was talking about how she was going to start being her own surgical PA, and she was going to be an independent contractor.
Well,
and,
look at me now. I'm in aesthetics.
but you did a little bit of that.
I did it for a little bit. So yeah.
Amazing.
All right, guys. We'll see you next time. Subscribe.
Subscribe.
Perfect.
Love it.